Hello viewers, this is Health Now Show, your health friend. And as I say all the time, that this is a show that looks into your health matters, issues that disturb you, conditions that you may have, and some of them you may not understand what it is. My name is Jane Karaoke. I am a counseling psychologist. And on this show, I host different professionals who come with different expertise on various issues in our communities, in our homes, in our workplaces, so that they can help us to live better lives and healthier lives. You can recall what we discussed in our last episode, our part 1. We talked about autism. And on that show, we looked at what is autism. Daktari went on and defined what autism is. We went on and talked about the predisposing factors or contributing factors, or what I was calling causes, but she corrected me and said it is about contributing factors or risk factors. And as we said, we saw that this topic is very, very important. And again, from your feedback, we asked a question that what are some of the things that you see in your child, and some of them you don't understand. And on this episode, we are going to look at symptoms of autism. And we'll continue with Dr. Maureen. But before we go to that, I would like you to continue giving us feedback, sharing feedback on Health Now Show on Facebook and also on YouTube. Answer the question, what are some of these things that you see? And what are some of the difficulties that you've been having with an autistic child that you'd like Daktari ajibu, or for the Daktari to answer these questions? And I believe that when we share this information, it will be helpful to us, because even if you are not the one going through with your child, you may have a neighbor, you may have somebody who goes to, a child who goes to school with your child, or they interact with your child, and you may be of help to that child. And without taking much time, I really want to allow Dr. Maureen. She is a pediatrician, neurologist, and I would request her and give her this ample time so that she can take us through the symptoms of autism, and we continue on. Daktari, karibu.
Asante sana. Thank you so much for having me again.
Yeah.
Now we can go through the symptoms of autism. I think the last time we had defined autism in 3 ways, as we had broken it down in terms of it's a social communication disorder and it has a restrictive repetitive behavior. So in terms of the symptoms of autism, I think I will go through those 3 parts.
Okay.
Yes.
All right, go ahead.
So in terms of a social communication disorder, what you may notice in the child in terms of symptoms is that they are not able to communicate with you effectively. So we talked about in terms of like the joint attention,
yes,
whereby if we are looking at something or you're pointing to something, then both of you can be able to enjoy whatever that is. So if I'm saying to the child, Mary, let's look at this book. So we look at the book together. But then Mary won't be able to look at this book as I'm talking to her to say, this is what we are discussing about. So there's no joint attention.
So where will the child look at?
So the child may just glance a bit at it and then look at something else, but we won't be able to share in this joint thing that we are looking at or we are discussing about.
Yeah.
Then they usually have delayed speech. They usually take a bit longer to speak. So you may notice that the child doesn't have the words that they're required to have at the time that, they start speaking. Actually, at 2 years of age, the child is supposed to join 2 words together. They are supposed to say something like, nipatie maji, tuende pale. That's the minimum at least they should do at 2 years of age. So they usually tend to have delayed speech. So at 2 years of age, they're not able to communicate their needs to you effectively. So the other thing that you will notice is, say for instance, it's not that all children who have delayed speech have autism. But then the extra thing that you will notice in your child, if the child has autism, is that despite the fact that they cannot talk, most children, maybe the children who have delayed speech, they'll be able to use nonverbal communication to be able to say what they want. So say, for instance, a child who is deaf, let's use that example, is not able to hear and so is not able to speak. That child, if they want something, they will be able to point and say, if they want food and they see an apple on the table, they'll point to it so that you give that to them. A child who has autism will not have this nonverbal communication, will not be able to point that, that's the thing. They may use other methods to be able to get that apple from that table. So one of the ways that we had mentioned last time, they'll come take your arm, use your arm as the tool to pick that apple. But they're not communicating with you. They're not telling you that's the thing. They're using your arm as a tool to pick the apple. They may also, for some children, they may do this, but not exactly point to the object.
Okay.
Yeah. Yes.
Like more general.
Yes, more general. They won't do, that's the thing. They will not point to the object. Yes.
Well.
Yes.
Good.
So in terms of nonverbal communication, so if, all of us look for other ways of communicating if you're not able to, to talk. So that's a big thing. If you're not able to say what you want without using speech, then that's a problem. That's an issue. Yeah. Then the other thing in terms of social communication is for the children who have autism and can talk. Like the way right now we are talking.
Yes.
You say something, I say something.
Yes.
You ask me about something, I answer accordingly.
Yes.
But then for children who have autism, they don't have that back and forth. So if you say something, I don't give you a chance to talk. I'll just want to say what I want. I have this pressure to just communicate by myself and give you that information without letting you have a turn to speak. And then the other thing that they may have is that even when they are talking, you'll notice that the content of their talk is very one-sided. They may have, they're just talking about, let's say, books, and they love books. They'll talk about books. If you start talking about, let's say, a toy, then they won't want to talk about that toy. They'll just be fixated on that one thing.
Because it's like they're thinking straight on one thing.
Yes. They're thinking on one thing, and their mind is now focused on that one thing. Yes.
Okay.
That's why I think most people think that, we talked about the high-functioning people.
Yes.
So that's one of the theories, that because they are very good at memorizing, they're very good at thinking of one thing. Then for the autism patients who are high-functioning, who have that capability, then they can be very good at piano, very good at computers. They will do one thing and excel in that one thing. Yes.
And the others are left behind.
Yes.
Other issues are left behind. If it is piano, if it's violin, it's that.
It is that. Yes, that is very true. So the other things, like in terms of being able to go have friends, other subjects, so they will have that one thing that is, they do very, very well. So in terms of also social communication, there's also the thing of eye contact. Remember we talked about eye contact?
Yeah.
Yes. So when you're talking and I'm talking to you, I may look away at some point, but really for most times when you're talking to somebody, you're looking at them majority of the time.
Yeah.
If you notice a child is not actually looking at you when you're talking to them, so they will avoid it. You will notice that you're trying to look at them, but then they'll keep looking away. Then they tend to avoid eye contact. That's a red flag. All children should be able to look at you. And a child who's less than 1 year, you're playing with a child, and then you're looking the child straight in the eyes, they should look at you and smile at you if you're smiling at them, It's also a way of communicating. I'm happy, you're happy, we are sharing in this happiness. Yeah. So if the child is not smiling back at you when you smile at them, is not looking at you in the eyes, I think it's time to just take a step back and try figure out what is happening to my child. And one of the steps to take is now to go to a health professional and tell them, all right, so the child is not looking at me when I look at them. They tend to avoid looking at me. It's not smiling at me when I smile at them. It's not responding to their name. What's happening? Yes.
I hear as you're explaining, and I'm like telling myself that kind of lack of eye contact may be misinterpreted to mean that this child is not respecting me, is not listening to what I'm saying. And that is not true, as from what you're talking, that it is because there is an issue. The child has autism.
Yes.
And as a parent, you may not be aware. You might be interpreting it in different ways. Continue.
That is so true. That is very, very true. So people misinterpret that eye contact. As you'd mentioned the last time, they may say the child is shy.
Yeah.
So it's sad because, you know, there are parents who come and then they say, oh, the child has not been, you ask them, has the child been looking at you in the eyes? They say, no, but, you know, that the child just keeps ignoring me. And I get very annoyed, and so I beat the child because the child is just ignoring me. That's bad behavior, you know. So I think what we need to know is that autism spectrum disorder has these symptoms, and it's not the child's fault, you know. It's the way that they are perceiving the world. It's, you know, the way that the connections in their brain, the way the connections are formed in their brain is different. So they see the world in a much more different way. And that takes us to the next type of symptoms that we have.
Before we get to that,
yes.
You've said something that is really important, that some parents or caregivers will say, you're ignoring me.
Yes.
I think parents will need to change that,
yes.
so that we are more alert, and so that we can help this child as early as we can.
Yes. That is so true. That is so true.
Go on.
So yes, so in terms of the symptoms, some of the things you will notice is the child may, so in terms of the restrictive repetitive behavior, we can talk about that. Yeah. They may have things we call stereotypies. So stereotypies are repetitive, are these behavior movements that that are usual to children who have autism. So they will, so for instance, there's hand flapping. Yes, when the child is very excited, they just do this. They can be running in a circle, then they just do this. And they're very excited. So that's one of the stereotypes.
And they're alone? They're not with others? They're just alone?
No, they can, like, let's say, for instance, mom has come home.
Yes, oh.
Yes,
mom
has come home from work.
Yes.
He's not seen her for a while.
Yeah.
He's very excited. Now, how he shows his excitement is now the hand flapping. So that's usually when the child is very excited, that's what they do. So they may do this and stand when doing this, or they may go in a circle when they're doing this. Yeah. Another stereotypy is like swinging, what do you call it, rocking. Yes, so they may just be, all the time they do this. Yeah, so that's another thing. They may also have other behaviors and movements like what we call steaming, visual steaming. So the children with autism, some of them, they'll put their hand in front of their face and then keep doing this. And then you're wondering, what exactly are they doing?
And there's no mirror.
There's no mirror.
It's just
their hand. Their hand, they keep bringing it close to their face. Others may just do this. Or they do this. So what exactly it is that it's a self-simulation sort of behavior, whereby when they do that, they perceive movement. They perceive that they're moving. So this behavior, if you see it, I think it's good to find out what's happening. Other children may have, you know, how they look at things. You know, like for instance, if you're driving a car or you're doing something, you will walk like this. You will look at something in front like this. But then for them, they may have some different type of looking at things. So they may see a child just looking at things like this. Even looking at the mom is calling. He won't look at the mother, but will, you know, sort of have a sideways gaze. And then now, you know, the parent may say, why are you not looking at me in my eyes? Why are you looking like, it's like for lack of a better word, madharau, you know. The child keeps looking at me sideways. Why is this child looking at me sideways? It is not
kind of it's sizing me.
Exactly, exactly.
Yeah.
Yes. So the child is really not trying to do anything to you. It is just the way that they are perceiving the world, and they will tend to do that even when they are playing with things, even when not even looking at you. When they are playing with toys, they may not play with a toy like this. They may just do this. Yes, when they are looking at things. So in terms of even the perception of things, if you some children are, so in terms of perceptions, we can talk about sensations. Yeah. So like taste, like sounds, so and touch, right? So if a light touch to a child who has autism may feel like pain.
Oh.
Yes. So if you touch the child, they may perceive it as pain. For some children, so different children perceive things different ways. For another autistic child, touch may just be touch. For other children, they want the touch. So those ones are the ones who don't like touch. Then there are those ones who want the touch. So they'll be very huggy. They'll want to be held all the time. You know, they'll go hugging everybody that they see. They're like, this one doesn't know boundaries. You know, they're just looking for that touch, because that one is calming for them. Yes. And then you'll find the autistic child who doesn't want to be touched, because any touch is like pain. So that's how they perceive that sensation of touch. So for some, the other sensation is a sensation of taste. We talked about, you know, some children may have particular likes in terms of how the texture of the thing is. So let me give an example. Like crisps is hard, ugali is soft. So they may not like a particular texture. They may want that hard thing, but then the soft thing they don't like. Or they may like something that is soft, and then they don't like the hard thing. So you may notice that they are picky with foods, yeah, because they don't like the texture of some foods. So because they are picky with foods, they may end up having constipation or diarrhea because of the choice of foods they have chosen. So that's a big issue, because you'll notice that most children who have those issues with taste perception tend to be, you know, less weight. They don't feed well. They have issues with their gastrointestinal issues, so they'll have diarrhea, constipation. They'll be the colicky child. So it's very important to seek medical intervention with that. Also, if you go back to touch, you'll find some children who like the touch will also be, if they enter this room, they'll just want to touch all the walls. They want to feel every single surface. Yeah.
And that may be misunderstood once again.
That may be misunderstood.
Yeah.
Huyu anapenda kushika tu vitu chafu, you know. But in everything, we have to look everything at a context, because they have to have most of these symptoms.
Okay.
Yes.
All right.
Then the other thing is, you know, in terms of the other sensation, the last sensation now is noise.
Okay.
If you hear, let's say, a blender, you won't run away.
I won't.
Yes.
Yes, I won't.
So for some children, if they hear like a very loud noise, they will just instantly start crying. They will run away to the next room. Yeah. So loud noise for some children is very irritating for some autistic children. Then that loud noise for another autistic child will be calming. So anytime there is a noise, like there's a radio, they'll put it at the highest volume, then go sit next. Because they want that sensation, they want that noise, to hear that noise. Yes.
Okay.
Yes.
Oh, wow.
So
this we are learning.
Yeah. So so those now are the sensory perceptions, how they perceive sensations. Then there's also the restrictive behavior. So they have, we talked about them needing sameness. So they want things in a particular way all the time. So they will want, you know, if it's toys, you may find some autistic children, they will arrange the toys biggest to smallest, or color yellows together, color reds together, like that. If it is, you know, clothes, they will want specific clothes. They don't wear blue. They want to wear yellow, or they don't wear red. They just want that particular type of clothing. If it is, you know, whatever it is, they will want it. Like, for instance, if at the household, supper is at 7 p.m. And then you decide, no, that day I want them to sleep early. So I want supper to be at 6 p.m. I want them to shower before. And they usually don't shower before supper. It will be now chaos.
Oh,
because
their routine has been destabilized.
Yes, the routine has been destabilized. So if the routine changes, then they get a meltdown because they are used to sameness. Yes, same everything. So for some, they also, in terms of restrictive behavior, some like sleeping with certain toys. There's a toy that they will carry around everywhere, or there's a toy that they will put in their bed, and if that toy is not in the bed, there's no sleeping. It will just be chaos in the house. So there's that, they like repeating things and desiring sameness.
Kind of a comfort zone for them.
Exactly. Yeah. That is very comforting for them. The scheduling, that's even one of the ways of managing it. To have a schedule is one of the management strategies, because they desire the sameness. Just provide the sameness. Make that a routine. There's eating this time, there's playing this time, there's this time. It gives them calm. Chaos does not work very well. Yes. So when we get a child who has autism, first of all, we have to confirm the diagnosis of autism. So one of the things that we do is that there's a criteria that we see to make sure that the child actually has autism. So as we had talked about it in terms of the definition, we look at and make sure that all the checks have been checked, all the boxes have been ticked, and has met the criteria. Now, there are different tools that we use in terms of making sure that that criteria has been met. And as we talked about it before, autism usually has comorbidities, and these comorbidities are usually the big issues, right? So you can have the medical comorbidities, which is like, for instance, because of the lack of issues with taste perceptions, they may be having constipation, they may be having diarrhea, so we make sure what's happening. They also epilepsy. We said that 20 to 30% of patients who have autism have epilepsy, so we have to make sure that we investigate. So based on that, we may do an EEG. So we know that about it before because of the previous sessions that we've had. But an EEG is an electroencephalogram, and it tells us about how the firing of the brain cells are. So it maps that out so that we can be able to tell whether the seizures are occurring and which types are occurring. We may also need to do an MRI of the brain. So in terms of the MRI of the brain, it will tell us whether we have structural causes that are leading to this autism. So we'd said before that, say for instance, if there are complications at birth, then that will give us the answer as to whether we have autism due to that. If we have certain medical conditions that also affect the brain, we'll be able to tell using the MRI of the brain. If we have any, tumors in the brain, then we'll be able to know by doing an MRI. But it's not that every child who has autism gets an MRI brain, but so that's why we need to look at the specific child that we have in front of us, and then investigate according to what that child presents with. Then other investigations that we do also center around the comorbidities of autism. So we talked about other conditions that occur together with autism, like depression, anxiety. So we also assess for these conditions to make sure that the child doesn't have autism, doesn't have anxiety or depression, and if they do, so that we can be able to manage these issues together. And also in terms of investigations, so say for instance a child has autism and has epilepsy, and we think it's a metabolic condition, so we will do a metabolic panel to just make sure that a metabolic condition is not what is causing this. And it is at this point I think I need to mention that I've seen a few parents coming, and then they say that they were doing a metabolic test, whereby they were told to touch. What was it? They were touching something that will tell them how the metabolism of different vitamins, different carbohydrates is. please, there's no test where you touch something and then it gives you results. Yeah, because I think people are preying on the vulnerability of these parents. And I think it's very unfortunate that that is happening. So just to say it again, there is no blood test that is going to tell you whether your child is autistic or not. There is no test that you're going to touch that is going to tell you whether the child is autistic or not. So please don't, be misled by people who say, oh, we're going to get a little bit of blood, tell you this is autism. No. We're going to make you touch a machine that is going to, to tell you, there's no that test that will tell you this or the other.
Mm-hmm.
Yeah, you need a wholesome approach to everything. And again, the EEG is electrodes that are put on your head, so it's not something you're really touching. And then the MRI, of course, you know about the MRI brain where you take pictures of the brain. But that is going to tell you about the causes or what is the risk factors, not to tell you that this is autism. This is autism is done by a medical professional using the tools that they have available to them. Yes.
Wow. So those are some of the tests
Yes.
that kind of confirmatory tests. So the misleading ones of touching,
Yes.
let us avoid them.
Yes.
Let us avoid them. Let us go to the professional because I believe they have what it takes so that they can be able to help us more. Daktari,
Yes.
let us go to management.
Yes.
How do I manage my autistic child? Yes.
All right. So I think the first thing to say is that autism is a lifelong condition, and it's not something that we are trying to cure. It's not something that we are trying to say that we are removing the autism. No, it is a lifelong condition. So what we are trying to do is help the child to be able to thrive and reach their fullest potential. Yes. So in terms of the management, what we are really managing are these other behaviors. So for instance, a child who is aggressive and has autism, then what we can do is make sure there's different medications that we can give to help make sure that the child is not aggressive. Let's talk about the social communication issues. So the child is not able to say what they want, is not able to talk. So we work in collaboration with speech therapists, work in collaboration with occupational therapists and physical therapists to make sure that the child is able to thrive in this environment. Yes, they're perceiving pain, touch in a different way, they're perceiving taste in a different way, but all these through therapies, different forms of therapies that you will be guided by your health professional, you can be able to follow that up and get the correct management. Then the other thing that we manage is the comorbidities. So we've talked about they may have sleep disorders.
Yes.
So they may be unable to sleep at night, so they stay awake the whole night. There is management for that, both medical and non-medical, non-pharmacological, let's use the word non-pharmacological ways.
Yeah.
So where we are not giving medicine
Yes.
for it.
Yeah.
There's also management of the depression that may come with it, management of anxiety, and that may also require use of medication for the management of that. And usually we also try to talk to the parents about things that they may do inside their home, even away from the therapists and all these medical things. We talk to the parents and tell them, what is it that you can do in your home so that you can create an environment that is conducive for your child to thrive. So we talked about how they love sameness. They want routine. So if, for instance, you've changed the nanny, it's a problem because now they've gotten attached to this one person. So if you changed the nanny, then they may have a meltdown. You may have, a bit of a problem adjusting. If you change, that doesn't mean that you keep the same nanny. But then
sometimes it's you have to change.
Sometimes you have to change.
Yeah.
So we also talk to them about coping mechanisms, about how to be able to understand the child, because we have to create an environment where the child is able to meet their full potential. So, like if they shower at this time, please make sure they shower at that time. They eat at that time. There is a schedule. There is a pattern to make life much easier. The other thing that
I think I interrupt you a bit.
Sure.
I'm looking at the routine.
Yes.
To help them manage. And I'm telling myself, probably you're taking a holiday and you're going to a new environment. Does it have any effect on this child?
Yes. So for most children, you will notice that, you know, like for instance, if you're taking a holiday, you're changing the whole environment. They may have resistance. They may not want to do what you're doing, to do the, you know, to change their environment. Let me give an example of coming to clinic.
Yes.
Yeah.
Oh.
So yes. So for a child to come to clinic for a session, to like if I've booked a patient and I've told the mom, let's see you at 10 a.m. on this particular day. The child will throw a tantrum because they don't want to enter to go to a different environment. They may throw a tantrum. So I usually tell the parents, prepare your child. If it's an older child, you have to prepare them and let them know, this is what we are doing. We are leaving the house to go to see this doctor, yeah? And this is what we are expecting. We will do this, and then we'll do this, we'll do this, we'll enter this car, and then we will go there, and then with this doctor. And then after that, this. You have to be aware that, you know, as in it's a child who you will need to prepare if you're doing any changes in their routine. So if it's an older child, you have to explain to them, yes? If the child is not old enough to be able to understand that this is what we're going to do next, then you have to make sure that they are with the things that they are used to. So similar things. So things that are, you know, familiar and comfortable to them. So if it's that toy that the child loves going with, it would be so sad. You've removed the toy and then you're changing the environment. You're just creating a, you know, a sort of a scenario whereby there'll be a lot of resistance.
So if they're coming to clinic and they have this toy,
yes,
let them come with it.
Yes, please. Yes, it will make even our work easier because they will be less irritable. They will be less aggressive because this thing that is giving them comfort and they want to stay with all the time.
Okay.
Yes.
Let's go on.
So in terms of like, you know, management, it's managing all these things that come together with the autism. There's one time that I got a child who came to clinic.
Yeah.
And then the mother had specifically brought the child for one thing. They were told that the mother was very concerned that the child is eating clothes. So the child is eating clothes. So the child used to just, you know, chew on the clothes. There's a lot of saliva everywhere. And the teachers are like, no, mom, this has gotten out of hand. We are tired of this behavior because now it's influencing other children, and you keep it, and the child is keeping on eating the clothes. So unfortunately, that was the first time that this mother got that diagnosis of autism. So I had to give her this diagnosis. You know, I evaluated, told her that, you know, this is actually autism. And this behavior of actually eating the clothes all the time is one of the symptoms of autism in this child. And then I pointed out to her some of the other symptoms. And we were able to manage that with the help of therapy to make sure that the child is not eating the clothes anymore. And then, of course, we had to contact the school and make sure that they are more understanding to some of these behaviors.
So I think that information then gets to the people that interact with this child, so that they can be more supportive.
Yes.
I've never heard about eating of the clothes, and that is really probably an eye opener to many parents that they may probably some have seen, and wanasema, kwa nini, why are you just unachafua nguo? I mean, why are you eating your sweater? Why are you eating your shirt and all that? And sadly to say, it's because the child is autistic.
Yes.
And you're not aware.
Yes.
And I think that is why it is very, very important for us when we are talking about these symptoms and even how to manage. Because if that now is known, that when the child is eating the shirt, eating for lack of a better word, or even sucking it,
chewing it,
yes. Yeah, it's a sign, and it will help in management. Then I think this will have really communicated to us, to our viewers. Okay, tuendelee.
Right. So, so some of these behaviors, some of these perceptions of taste, of noise, of taste, like even the clothes, of noise. Some children may want just to walk naked because they don't like the feel of cotton on their clothes. So all these things are manageable. We can be able to manage to create a thriving environment for your child.
Yeah.
And then, of course, the ones who are, who love specific things, we drive them towards those things. So, for instance, if they love piano, they are very good at piano. They can be the best piano player in the country, Just help them do what they love doing, and then they will be very good at it.
Support them.
Yes, support them fully. Support them fully. There's this misconception that apparently children who have autism have intellectual disability, that all children who have autism have intellectual disability. So the fact that your child is not speaking to you does not mean that your child is not understanding and is not intelligent. That's not true. So it is very good to be aware that these children, it's only, like 25 to 30% who have intellectual disability. And we actually, as healthcare professionals, look for it and manage appropriately. But there's also this larger group who don't have intellectual disability and can actually have jobs, lead fulfilling lives. I mean, we have colleagues who are autistic.
Yeah.
You may not notice it, but they do have autism, but they are good at what they do.
Yeah.
Because they are good at memorizing. They are good at doing specific things in a specific way. So repetitive behavior. So may be very good at computers because it's numbers all the time. Numbers. Yes.
I have a friend, a young man who is autistic, and when I give him work, or to write,
yes,
his handwriting is perfect. It's so nice.
Yes.
Everybody who is working with him will say that so and so writes so well, so clearly, and you just want to give him work to do that, and he will concentrate and do that work. That is what you're saying.
Yes, that's exactly what I'm saying. And for your friend, what you can, people there are different types of jobs, and one of the jobs is calligraphy. He can get into calligraphy, like do art for cards, things like those, and actually make a really good living out of it.
Wow.
Yes.
There's a lot of positive that can come from it.
Yes.
Okay. Continue with some of the misconceptions.
Yes. So, so some of the misconceptions is also that children who are autistic cannot be able to live full lives and be able to thrive in the world. So what we do as healthcare professionals is to make sure that the comorbidities are sorted out so that they may be able to thrive in whatever it is that they choose to do. So for the ones who have intellectual disability, we give them help in that, and then also we help to lead parents to like the technical work that, for those ones who like technical work, we can be able to take them to connect them to those places that they can be able to do that. I think another big misconception is in terms of what causes it. Yeah, so people will say that autism is because of, traditionally, somebody will say that amerogwa, somebody did something wrong, that has caused the child to be autistic. So not at all. So that is not the case. So for those, there are some causes that we have not yet figured out what it is. There's some that could be environmental because of the type of paint that you've used in your house, although those types of paints have been phased out. So environmental toxins can also be a cause, but it's not really somebody did something to you or to somebody who came before you that has caused the child to be autistic. Yes.
Okay. Because this information actually needs to really get to our viewers, that when you notice something that you get concerned about, don't go to issues of like merogwa is witchcraft, is something that you did wrong and you are paying for you the mistake, but and then that time the child is getting worse, probably is getting worse. Yeah. Any other misconception?
So the other, I think, misconceptions is about food. So I think most children, most parents who come, they say, you know, I think this particular food, I'm not supposed to give it because it will make the autism worse. Yeah, because there's all sorts of information everywhere.
Yeah.
So there are some, you know, the work that we do, the management that we give to children, to everybody, is based on studies. So studies, research that has been done that shows that this works or this doesn't work. Then we use that research that is evidence-based in terms of managing the children. So there are no large studies, you know, for you to say that you're using research as a tool to manage the patients. You need good research that used very many children and so showed that there's actually benefit or there's actually worsening with specific foods or specific things. So we usually don't advise because for children who have autism and say, for instance, also have issues with taste perception, you can imagine telling them that you can't eat this food, and that is a food that they really like how it tastes, and it's a healthy food. That will actually cause them to even lose more weight. You'll have issues with weight gain and general health of that child. So I think even as we are getting information, I think it is important to get information from healthcare professionals so that we give the correct management to these children. Yes.
And even in addition, I'm guessing that even a nutritionist would also add something, some value.
Yes, very true. And thank you for bringing that up. A nutritionist is very key in terms of adding value to the health of children who have autism. And autism is actually a condition that needs to be managed by very many people. So as we mentioned, they need therapy. So they need a speech therapist on board. They need an occupational therapist. They need a nutritionist. We also make sure that the teachers are involved because their life in school is a major part of how they will grow. I mean, they spend more time in school than they do at home anyway. So we need to we usually get the teachers on board to make sure that the school, the teachers understand what is happening, that they can be able to create an environment that the child can thrive in. So it's actually a multidisciplinary sort of approach that we use when we are dealing with children who have autism. Yes.
So what now I'm seeing as even we come to a close is that like communities in school, communities in churches, in mosques, in social places.
Yes.
We all need this information that so that we can help our children better. And probably as we close, Daktari, what is your parting shot?
Autism is a condition that is affected. It's a brain condition, and it's characterized by a child who understands the world in a different way. So some people usually use the word neurodivergent. It just means that this child is perceiving things in a way that is different from you and me. That does not make them, you know, disabled or, you know, things like that. And autism usually comes with many other things. It may come with epilepsy, it may come with depression, and all these conditions need to be managed. And in terms of the care for a child with autism, please make sure that you visit a healthcare professional so that they can put you in touch with all these people who are required for the proper management of a child who has autism. Yes.
Do we have like, though it was your parting shot, do you have some like support groups or something like that?
Yes, there are support groups for autism. And actually one of the other conditions that come together with autism is something called attention deficit hyperactivity disorder. These children who are very hyperactive, they want to run everywhere, you know, all the time, or they want to, you know, they are unable to concentrate because they will think about something, go to another thing. So there are, you know, support groups for that. So there are support groups for autism and ADHD together. There are support groups for autism alone and ADHD alone. So I think, and these are available on Facebook, on WhatsApp. And anybody who has, wants to get further information, I think can reach out to a healthcare professional, and then we can be able to link them with all these support groups.
Okay. And at that point, kindly share where parents can get you, or where guardians can get you, caregivers can get you, so that if they have noticed something in their children, they can be able to get help.
Okay.
Kindly share.
All right. So I'm available in Kiambu Doctors Plaza, and my contacts will be displayed at the bottom of the screen, and you're welcome for any consultation and even for support for your child.
Thank you so much, Daktari.
You're welcome.
It's been really a pleasure to have you.
Thank you so much.
And to really get to learn so much, and for our viewer to really learn so much. I believe that is really helpful for all of us. And our viewer, for this episode, we come to the end of it. And I believe that you have learned so much as I have. And I believe you'll continue giving us feedback, sharing with us. And any concern that you may have, have seen in your child, and you have observed and you may not understand, kindly just get into our Facebook, Health Now Show, our YouTube, Health Now Show, and we'll be able to, Daktari will be able to respond on those. Because we are living in a community, we are living in, our children are going to school, wherever they are, and some things you may not understand, let the professional help us. And I believe that we'll be able to live healthier lives. Today we have talked about autism. The previous episodes we have talked about epilepsy, and our next episode upcoming is going to be on cerebral palsy. I'm sure you'll be waiting for it, as I am. Until then, thank you so much. Have a blessed time. See you then when we come next.